So the standard of care in CTCL is a little complex because to some degree there's almost no standard of care. So I like to break down the patients according to either they have early stage de novo untreated, and you have to make a decision about how to approach those patients. For that, the standard of care is some type of skin-directed therapy. So that could be either ultraviolet light, it could be some other forms of topical therapy, it could be topical chemotherapy or topical steroids, topical retinoids, it's another one. Another forms of topical of skin-directed therapy is electron beam radiation. Either as in the form of total skin or as more focused, involved field. Then there is a fairly large group of patients that have early stage, but they have failed multiple lines of skin-directed therapy. So for those patients, the standard of care is either often is a continuation of some type of skin-directed therapy, but at that point you're going to have to add some systemic therapy. That's one of the biggest clinical challenges that there is in CTCL right now. When you cross the threshold of requiring systemic therapy. For that, again, there's no single best standard. There's no consensus criteria as to how and when that trigger goes off. Regarding the systemic therapy, these are the same systemic therapies that are used, at least for now, in a more advanced stage. So that's the third category of clinically of patients with more advanced stage. And there are several drugs that are, have been approved and they're being used. Historically, retinoids, systemic retinoids are, still being used. Methotrexate, oral methotrexate is also being used. And sometimes chemotherapy as well, more rarely, fortunately. Then there are a number of drugs that have been approved more recently that are, HDAC inhibitor, histone deacetylase inhibitors, particularly vorinostat and romidepsin. The brentuximab vedotin is an anti-CD30 monoclonal antibody targeted adjuvant type of immunoconjugate antibody. And then mogamulizumab most recently. So moga is an anti-CCR4 monoclonal antibody. These are the current standards for systemic therapy. There are several drugs in development, including most advanced lacutamab, which I just mentioned, in clinical trial on telemac. So those are the drugs.